We are here in the operating room, and I thought some of you might like to see some of the instruments that we use for rhinoplasty. So we put a bunch of the instruments up here on our Mayo stand, and I'm going to show you some of them. This one, though, I want to start with this one because it's one of my favorites. When I first moved here to Utah and started at the University of Utah, they had this instrument here. I don't know if my friend Steve was the one that had this or if they just had it for a long time. This is called the Anderson-McCullough. I'm not sure which end's Anderson or which end's McCullough, but it's this little tiny thing that we use to get down on the cartilage and help free up the soft tissue off it. Little tiny delicate instrument. So really fun instrument, we love it. This little fun guy is called the Boyce elevator or the Boyce septal elevator, but it's more affectionately called the butter knife because it's kind of like putting some butter on your toast, like this. This is the Parks retractor. This is the Alfred retractor that we use to kind of retract the skin of the nose up. These are some little forceps that we use. These ones, the way that these the ends of them are, we use these to grab cartilage so it doesn't crush it or make a hole in it. These little tooth forceps we use to close the skin because this little tooth thing is actually less traumatic to the skin. This is called the Joseph elevator, named after Dr. Joseph, who was the person who's credited with performing the first rhinoplasty. We use this to kind of separate the periosteum or the lining of the bone off the bone itself. This is called a Freer elevator that we use to kind of separate some of the cartilage off. It's this little kind of curved thing. Caudal elevator, after Dr. Caudal. It's got this little thing here that we use to lift up the cartilage, the perichondrium off the cartilage. This is called the round knife, and yep, that's right, you guessed it, it's named after Dr. Round. Just kidding, it's because it's kind of round. You see it right there. These are some hooks that we use to retract. Oh, this is kind of a fun one. This little thing is called the morselizer, or sometimes it's called the smasher. We kind of we put the cartilage in between here, and sometimes we'll crush some of it, and we'll use that to put on top of things so you can't see the edge. But you can kind of see what that looks like in here. Here's some scissors. These are kind of some fun scissors called the Knight scissors. Converse scissors. Tenotomy scissors. This is kind of our friend, the Gruber retractor. It's kind of a weighted thing, so it kind of sits here. Now these are the speculums. We use these to kind of open up the nose, kind of like this and look in. This is the Killian speculum, the caudal speculum, the Vienna speculum. This little grabber instrument is called the Takahashi. It's what we if we reach kind of far back into the nose, we use this to kind of grab the pieces of bone. And then these are a couple of our favorites. These are little files or rasps that we use to kind of smooth the bone down. These little things are osteotomes. We use these to kind of make little cuts on the bone. So if we're making a cut on the bone here, we might use this right here inside the nose and use it to cut that bone like this so that we can move the bone around the way that we want to. And that's a little tour of the instruments that we use in rhinoplasty, at least some of them. I hope you enjoyed it.